COVID-19 is markedly impacting women and children's access to essential nutrition services. Maintaining the essential nutrition services using supplementation and to deliver vitamin A for young children, iron and folic acid and multiple micronutrients for pregnant women and breastfeeding mothers is an important approach to preventing hidden hunger and the additional mortality that we may be able to see from the mitigation phase of COVID-19 during the pandemic.
So my message is basically to countries, and it's threefold. Number one, for countries who have, taxes and duties on vitamin and mineral premixes, I think now is the time to remove them, more so within the context of COVID pandemic. It doesn't make sense to tax a product that's there for public health, purposes. And for the big, grain or food exporters, I think this is not the time for export quotas or export bans. I think it's a time for solidarity. Lockdowns may be a way to contain the pandemic, but for us to defeat malnutrition, we need to keep markets open and let food flow across the borders. And finally, for countries that are fortifying, this is not the time to let off. We need to maintain the momentum. For those that are in the early stages of fortification, it's the time to scale up. And for those that provide foods, through social safety nets, it is important that they include fortified staples in their food distribution basket.
So research shows that nutrition-sensitive social safety nets can be an effective strategy to improve diet quality and protect against micronutrient deficiencies and emergencies, including in this pandemic. Policymakers should make sure to prioritize the needs of women beneficiaries and provide them with nutrition information when possible. Food rations should be micronutrient fortified, but whenever possible, keep beneficiaries safely linked to markets through cash transfers to promote availability and access to nutrient-rich foods such as biofortified foods and other sources of high-quality foods and markets.
What we have seen here is that if we are not careful, the COVID-19 crisis can set us back several years in our efforts to eliminate all forms of malnutrition and micronutrient malnutrition in particular, but it doesn't have to. And I think this crisis also presents a unique opportunity for the global nutrition and food systems community to join forces and stand together for nutrition, to ensure that we continue to make progress towards eliminating all forms of malnutrition by 2030.